dear Toastmasters, guests. As some of you know, I lived nearly a decade overseas in a number of countries. I was a graduate student in London, and most recently, an educator in South Korea and Spain. I've been blessed to see the rice paddies of Bali and sunsets on islands most people have never heard of, an Elysian experience. However, a year ago, I decided it was finally time to come back to the USA and repatriate myself for good. I love traveling, but I also love my country and I miss Texas. I miss the food, the weather, the people. I found myself wanting to come home. However, the one fear that I could just not shake was the idea of coming back to deal with the dreaded US healthcare system. It seemed to be the one factor I couldn't control, no matter how much of a hardworking American I was. That lack of control of health expenditure terrified me. Overseas, I remember a barrage of government emails bombarding my inbox with solutions for not being covered with health insurance. When I left the US, there was no such thing as mandatory coverage for health insurance. There wasn't a penalty for not having it, but right before leaving, all I remember were nagging emails urging me to sign up to get covered or else. Urgent, 24 hours remaining, the subject title read. And upon opening it, I read the bold letters. You could be penalized $695 for not being covered today, for not being insured. I think the last 4 years in Madrid, in Spain, had spoiled me. I could walk into virtually any clinic in Madrid and receive the service that I needed without paying a dime. The most that I paid for a prescription was €5. All of my memories of healthcare in the USA were not bad. I remember being transported when I was 17 years old in a stretcher for being immobilized after having really painful, immobilizing cramps that wouldn't cease even after 6 hours of medication, only to have a bill arrive in the mail of $500 for taking strong painkillers through an IV. I learned very quickly at a young age, you don't go to the hospital unless you're dying. And I still have a hard time to this day thinking any different. When I was in Korea, I remember a friend being transported for $50. Well, what would be the equivalent of $50? And she only had the responsibility to pay $25 of it. I remember my experiences in a US hospital too. I don't often go to the doctor, but when I do, I'm usually like everyone else, in and out. And that's not because I want to be, but that's because time with patients and doctors are very limited. They're not only limited, but they're controlled. Did you know that your doctor probably spends more time with their computer than they do with you? And I didn't think that was true, but after researching, I found out that it was. Between seeing family members pushed out of the emergency care and having 11-minute lightning round appointments with the doctor myself, the patient experience for me had always been far beyond optimal. I was not alone in this thought. In my last few months abroad, I found out that I had a uterine polyp that needed to be removed. And as a woman, you can imagine that's pretty scary. I didn't know what that meant. But it was done immediately after diagnosis. It was quick, it was painless, and it was a procedure that was paid for, which eased a lot of my qualms. But I found my list of health issues growing. A polyp here, dysmenorrhea there, and then I found out I had a cyst. So as my list of problems began to grow, so did my fear, worrying for finding accessible healthcare upon return to the USA. Even if I did have some of the things taken care of, I knew that it would need to be monitored and controlled. I knew that I would have to go to see a primary care physician, and I didn't know where I was going to be able to find a clinic for a reasonably low fee with decent quality. And I found myself asking questions like, what if I just need a basic checkup? Why should I have to suffer through a fever, through back pain, a headache? Where can I get primary care, and how ridiculous is the cost going to be? How much is my copay going to be? How long am I going to have to wait for an appointment? I thought about what to do if I needed an employment physical. I had so many questions bombard my mind that I didn't even know where to begin. Mind you, I've been overseas for 10 years. And as my head started swirling, thinking about all of these things of what to do, I finally just decided to let everything rest. Fast forward to July of this year, and I finally had an experience that I didn't even know was possible in the US. After becoming an employee at Shanks Web Development in San Antonio, I realized that I was now a member of Direct Med Clinic, which is a direct primary care clinic here, and they provide urgent care, primary care, all of the tangible things that I needed at an affordable price. I was so eager to get a checkup. I remember being really excited, calling all of my friends and telling them, look, I can actually go and see a doctor. And I emailed my doctor. I got a response right away telling me to schedule an appointment for the next day at 2 p.m. Is this even real? I don't remember ever being able to make an appointment, let alone through email. I didn't even know doctors actually did that with patients. The entire concept was so foreign to me, but I agreed to have this mysteriously good-sounding doctor's appointment. I walked in the next day to meet Marlene Pallett, who was an RN, and Dr. Raja Muchigemba. And everything that I had learned about direct primary care, all of the research that I had done, held true, every single word. I was greeted at the front desk as I signed in, sat and waited to be seen. And as I swiped my card for $10, I just still couldn't believe, like, this is actually true. I'm only paying $10 to get seen. I sat down, I picked up a magazine, I relaxed myself as I heard these gentle voices in the background, and I later met with all of the staff, and it was shown around the small but comfortable clinic. I remember there were San Antonio Fiesta photos all around the room, the warmly colored maroon walls, and everyone seemed to be really happy. My vitals were taken, I sat down, and shortly I was met by Dr. Muchigemba, who, after examining me, he was really honest in his approach, but asked my personal opinion on what he wanted to happen. I could tell that they were both happy, and I was really happy that I finally had an experience that was true to what the American dream should be, to have accessible and affordable care for hardworking Americans.